यूथ ऑफ GSB वीक्षकांक नमस्कार. यूथ ऑफ GSB री आम्ही तुमगेल मुखारी विंगड विंगड इन्फॉर्मेटिव्ह व्हिडिओज प्रतिपन धाडता आसताची एक कसले एक अवेअरनेस क्रिएट करचे तसले एक प्रयत्न यूथ ऑफ GSB री निरंतर चलता असता. आयच्या ह्या एक व्हिडिओन तूय आम्ही तसले एक इन्फॉर्मेटिव्ह कंटेंट घेवन तुमगेल मुखार आयिल्ले आसाची. आयच्या ह्या एक व्हिडिओन तू आमगेलो टू डॉक्टर अभय कामत हांणी आमगेलो टसेच हांकां आयच्या कार्यक्रमाक मोगान
नमस्कार.
एक ब्रीफ इंट्रो दिवन सोडता डॉक्टर ममाल बग्गे हांणी कन्सल्टंट ओरल अँड मॅक्सिलोफेशियल सर्जन जावन आसाची. हांणी एडवान्स्ड ट्रॉमा अँड TMJ ट्रेनिंग ऑस्ट्रेलियांतू केलेलें आसा. तशीची हांणी एडवान्स्ड फेशियल डिफॉर्मिटी करेक्शन हाजे ट्रेनिंग लंडनांतू घेतिल्लें आसा आनी ट्रेनिंग इन TMJ रिप्लेसमेंट इन अटलांटा जॅक्सनविले USA आनी ट्रेनिंग इन TMJ आर्थ्रोस्कोपी इन टोरंटो कॅनडा आणि MDS फेलोशिप इन क्रेनियोफेशियल ट्रॉमा टोटल TM जॉईंट रिप्लेसमेंट फेशियल एसिमेट्री हांतू स्पेशलायज केलेलं आसा. डॉक्टर अभय कामत इज द बेस्ट मॅक्सिलोफेशियल डॉक्टर इन मँगलोर आणि करंटली ओरल अँड मॅक्सिलोफेशियल सेंटर KMC हॉस्पिटलांतू हेड करता आसाची. हांणी कंट्रीच्या एक फोरमोस्ट ओरल अँड मॅक्सिलोफेशियल सर्जन जावन आसाची. डॉक्टर कामतान फर्स्ट रिपोर्टेड टोटल जॉइंट रिप्लेसमेंट एक प्रोसिजर ऑन द डिस्ट्रॅक्टेड मॅन्डिबल इन 2017 हांणी परफॉर्म केलेलं आसा. तशीच हांणी वन ऑफ दी मोस्ट एक्सपिरियन्स्ड सर्जन्स विथ मोर दॅन 450 प्रोसिजर्स KMC हॉस्पिटलांत वय हांणी केलेलं आसा. फर्स्ट पिडियाट्रिक TMJ जॉइंट रिप्लेसमेंट हांणी इंग्लिश लिटरेचरांत वय केलेलं आसा. फर्स्ट टोटल जॉइंट रिप्लेसमेंट इन इंडिया KMC हॉस्पिटलांतू केलेलं आणि एक्सटेन्सिवली ह्या वेरियस रिजनल अँड नॅशनल मिडिया आउटलेट्सांनी कवर केलेलं आसा. आणि एक ओरल सर्जन जावन मंगळुरांतू सक्सेसफुली डेंटोफेशियल डिफॉर्मिटी प्रोसिजर करेक्शन कॉस्ड बाय TMJ Ankylosis वाया टोटल टेम्पोरो मॅन्डिब्युलर जॉइंट रिप्लेसमेंट एक 10 वर्सां चेडा वयरी हांणी केलेलं आसा आणि मल्टिपल सर्जरीजाच्या एक हिस्ट्री वय हांकां आसा. ह्या एक ब्रीफ इंट्रोडक्शन जाल्ल्या आयच्या ह्या एक व्हिडिओंत आमी मॅक्सिलोफेशियल सर्जरी ताजे स्कोप आनी ताजे बग्गे एक अवेअरनेस क्रिएट करचे तसले एक उद्देशार आयचे एक व्हिडिओ करता आसाची. आयचे व्हिडिओ मस्त तुमकां हेल्प जाता म्हणून सांगून आमी लेखताचे. डॉक्टर बाम सुरवे क्वेश्चन निमगूच म्हणजे जाल्यार हें कसलें हें मॅक्सिलोफेशियल सर्जरी म्हळ्यार कसलें आनी हाजे स्कोप कसलें?
मॅक्सिलोफेशियल सर्जरी म्हळ्यार इट्स अ पार्ट ऑफ डेंटिस्ट्री. आता डेंटिस्ट्री करताना there are 7 broad subspecialties. Maxillofacial surgery is one of the specialties of dentistry, where we deal with diseases of face, mouth and jaws. म्हळ्यार तोंडा भितरी, तोंडारी आणि जॉइंटा भितरी कसन जाल्यार it is handled by a maxillofacial surgeon. प्रामुख्य जावन तोंडा कॅन्सर्स, गुटखा, तंबाखू पुरा खावन जल्लेल कॅन्सर्स are dealt with maxillofacial surgeons. Number 1. Secondly, Kannada antu there is a saying buddhi hallu manu. Mala English antu we call it as wisdom tooth. It normally comes in the age of 18 to 21 years. Mast cherduang to danti yana. So tawal kasa korka. We normally get an X-ray done to find out if the wisdom tooth is come. Kelavu sati wisdom tooth bitar aslari bonache. Tahi ek cyst jo tumor form jo sadhyatas. So त्याची सर्जरी करची मॅक्सिलोफेशियल सर्जन्स.
ओके.
सो अदर दॅन दॅट वी ऑल्सो डील विथ ॲक्सिडेंट्स ऑफ द फेस. मरात बाईक चलयतना खंयचे ट्रॉमा जाल्यार ॲक्सिडेंट जाल्यार एनी ॲक्सिडेंट्स टू डू विथ द फेस, आयज, इयर्स, नोज, फेस इज डेल्ट बाय अ मॅक्सिलोफेशियल सर्जन. मागीर सन चेडवांक जन्म घेतील चेडवांक क्रेनियोसिनॉस्टोसिस म्हणून आसता. म्हळ्यार द सुचर्स ऑफ द forehead or the brain area fuse prematurely. त्या सुचराक ताका क्रेनियोसिनॉस्टोसिस म्हणटाची. ताची करेक्शन maxillofacial surgeons do with the help of the neurosurgeons.
Okay.
There are many such procedures which maxillofacial surgeons do. अनेक कसं म्हळ्यार facial aesthetic surgeries आणि jaw deformity correction. ಕೆಲವು ಚೇರ್ಡುವಂಗೆ तू पळोवन आसचें पुरो रोडार वतना हें तोग्गू जॉ येद्र आसता, वयलची जॉ मागशी आसता. तसल चेडवांक खावच्या पिवच्या तोंदर आसता. सो तांगेल ते जॉ येद्र आनी मागशी करची सर्जरी इज ऑल्सो परफॉर्म्ड बाय द मॅक्सिलोफेशियल सर्जन.
ओके. सो ते मॅक्सिलोफेशियल सर्जन आणि एक प्लास्टिक सर्जन डिफरन्स कसं
Difference between plastic and maxillofacial surgeons is not very mast tak difference monna. Both entail and do the same work.
Okay.
But where does the maxillofacial surgeon stand out is ammi surgeons jaunu danta knowledge chadastam ka chapche dant ka sheka ek kudsun etta tawal ta kudsun etta na akasmat fracture jaun asler tawai sam korka dantu alignment ayevka. So that job is better done by a maxillofacial surgeon. Plastic surgeon and maxillofacial both do the same, but the surgical practice of doing core maxillofacial surgeries, malaya TMJ replacement, facial deformity, tasal pura specialized core areas we have done. Tantu anika churda knowledge given, we are doing it more in this, because as you know, plastic surgery is not restricted only to the face. It's generally to the body. So very few plastic surgeons specialize on the facial architecture. Whereas maxillofacial, malli kudla, it is only to deal with the face.
ओके. सो आता तुम्ही म्हणतानाच एक वर्ड आहे TMJ म्हणून सांगून हे TMJ अँकायलोसिस म्हणून सांगून ऐकत असता आम्ही ह्या म्हळ्यार कसं जालें आनी ह्या एक चडा लायफ कशी एफेक्ट करता
TMJ म्हळ्यार फर्स्ट ऑफ ऑल आम्ही तोंड ओपन करचे जेवण करचे खावचे, इट्स ऑल हेल्प्ड बाय दिस जॉइंट विच इज देर ऑन माय सायड ऑफ द फेस. आमी हां करतना हें जॉइंट मूव जाता. सो हें TMJ अँकायलोसिस म्हळ्यार हे बोना वचून वयलची बोनाक फ्यूज जावचे, वेर द बोन्स फ्यूज टुगेदर. बोन कशी फ्यूज जाता आपापी जायना. मिगेल आनी तुगेल आनी इट्स नॉर्मल. When a person falls from a road traffic accident on the road, when he's got a trauma, and if there is a fracture of the lower jaw and both the joints, yeah, joint some karni malari ammi kannada sangtachi rakta heppakattodu malari clot formation jawche. So now if this clot formation happens inside the joint, and if the surgeon or the doctor or the patient is not aware, then starts formation of new bone, and this bone joins to the bones of the skull base. ಮಲರ್ ಮನುಷ್ಯನ ಬೊರ್ಡೆಯ ಕೆಳಗಡೆ ಇರೋ ಎಲ್ಬಿಗೆ ಫ್ಯೂಸ್ ಆಗುತ್ತೆ ಜಾಯಿಂಟ್. ಸೊ ತ್ಯಾ ಜಲ್ಲಲ್ಲಿ ಪೆಟ್ಟಾಕ ಫೇಶಿಯಲ್ ಡಿಫಾರ್ಮಿಟೀಸ್ ಅತ್ತ ಮಳರಿ ಚೆರಡ ಅಂತ ಜಲ್ಲರಿ ಗ್ರೋಯಿಂಗ್ ಪೀರಿಯಡ್ ಆರಿ ಏನ್ ಗ್ರೋ ಜಾಯ್ನತಿಲ್ಲ ಬರೀ ವೈಲ್ಚಿ ಮ್ಯಾಗ್ಸಿಲ್ಲ ಮಳೆ ಮೇಲಿನ ದೌಡೆ ಮಂಟಪಳೆ ತ್ಯಾ ಮಾತ್ರ ಗ್ರೋ ಜತ್ತನ ತೊಗ್ಗು ಜಾಯಿಂಟ್ ಗ್ರೋ ಜಾಯ್ನ. ಸೊ ತ್ಯಾ ಜಾಯಿಂಟ್ ಗ್ರೋ ಜಾಯ್ನಿ ಮಳರಿ the child will end up with like a bird face. Mala kailasta pada. Kaila padaitan side adukunu. It's got only a beak. Yeah, na takka. The shinchi cherdu valanti yan jalli malari. The child will not have development of this jaw. Only the upper jaw develops. So yan jattana cherd tond open kuru jaina, khau jaina, ullocha jaina. Worst of all, yan jallal miti. Because the airway becomes narrow, यहाँ develop a जाइनी, यहाँ खैयस की थैयस, airway narrow जल्ल time मारी, the child develops sleep issues, snoring issues, श्वास कड़ु कष्ट आता. In these cases, you have to intervene surgically, but the opposite can be happening even in adult patients. Suppose एक patient आइलो, who is 23 years old, he's had a fall, bike अर्दुकुन पड़लो. तक्कंगे एक्सीडेंट जावन अंग प्लेट घालना हें विसरलींच म्हळ्यार हें आसा म्हणून गोतना बायलतूल सर्जन्सांक हू डोंट डील विथ दीज जॉइंट फ्रॅक्चर्स. सो वॉट हॅपन्स, ब्लड क्लॉट फॉर्म जाता, तोंड ओपन जायना, 6 म्हयने भितर तोंड बंद जाता. दॅट इज अँकायलोसिस इन एडल्ट पेशंट्स. तावळ कसं कोरका सर्जर कोरनू सम कोरका चेरडू वालांतू आमी सर्जर कोरनू सम कोरयता जाल्यार इट इज प्रोन फॉर रिकरन्स.
ओके. सो ह्या एक रेअर कंडिशन की कॉमनली पळोवचा मेळटा चेरडू अंतू
फुडें कॉमन आशिल्लें. बट एज ऑफ टुडे बिकॉज ऑफ एडवांसेस इन सायन्स एंड टेक्नॉलॉजी आतां कसने आनमत दे आर मोर वेल नॉलेजेबल. चेरडान खंय सान स्टूलार दुखून तोग्गु पडली कुडले अंग पेट्ट जल्ल म्हळ्यारी गद्द म्हणटा नाव कन्नडांतू. अंग पेट्ट जल्ली कुडले फर्स्ट थिंग दे नीड टू डू इज गो टू द डॉक्टर एंड गेट एन एक्सरे डन टू अंडरस्टँड जॉइंट फ्रॅक्चर खंय आसवा म्हणून पळोवच्याक. Yeah, pudita pura nashila. It was very common. Awareness unashila. But today, if you ask me, the awareness is more. Only request is not to neglect these falls, whether it's in an adult patient or a child patient.
ओके ह्या जावचाक रिजन कसं असतं म्हणल्यार पोटचे निमित्त मात्र जावचे की आर देर एनी अदर रिजन
Perfect. Yeah, पोटची दशल मात्र नाही. There are many other reasons. आम्ही सांगताना if the mother is due for delivery, those days what they used to do is they used to put forceps inside and pull the child out during delivery.
Okay.
They used to call that as forceps delivery.
Okay.
त्या forceps भितर घालतना त्या चेरडाल मात तेर्दावरून तणतण कसं जाता आशिल्लें त्या फोर्सेप्सा प्रॉंग्स आसा पळय ते हांगा घेवन बसता आशिल्लें हांगा घेवन बशिल्ल्या टायमार कसं जाता प्रेस जातना जॉयंटा पेट्टू जॉयंटा पेट्टू जाल्ले कुडले बोन फॉर्मेशन सुरू जाता and child comes out and then ankylosis suur jata gura.
Okay.
Other than these causes, ankylosis can or fusion of bones to the skull base can also happen when you have ear infections.
Okay.
When you have an ear infection which goes untreated, especially in children, especially in adult patients, it can lead to ankylosis. Granthi mantach, malay glands, salivary glands. Infections from here can spread back into the joints and cause restriction in mouth opening. So these are other causes for your ankylosis.
ओके सो तितले पुरे रिजन्स आसता ह्या जावचाक अर्ली सायन्स कसं पळोवन घेवका आतां आमकां हें जाल्ला म्हूण कळूंक लागता दी अर्ली सायन्स
Earliest signs in jalla म्हूण कळूंक the child or the adult patient will definitely say my mouth opening is coming down gradually. म्हळ्यार तोंड ओपन करूं जायना पेशंटाक
पेनफूल आसता
पेनफूल आसता आनी वता 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 3 फिंगर आशिल्ले नॉर्मल मनशाक तोंड ओपन एक सांग टेस्ट कसं म्हळ्यार हाऊ टू अंडरस्टँड वॉट इज युअर नॉर्मल माउथ ओपनिंग फॉर एनी पर्सन अ नॉर्मल माउथ ओपनिंग इज अबव 3.5 finger breadth. If you keep your 3 fingers vertically, if your 3 fingers are going inside your mouth, you're good. But anything below 3 fingers with the history of fall or any infections, if there is considerable restriction in opening the mouth, that means to say there is something happening inside the joint.
Okay.
So the earliest sign what you asked me is difficulty in opening the mouth.
Okay.
And in a child, earliest sign is difficulty in opening the mouth as well as facial deformity.
Okay.
ಇದು ಬೆಳೆಯುತ್ತೆ ಆದರೆ ಕೆಳಭಾಗ ಬೆಳೆಯೋದಿಲ್ಲ. We call that as bird face deformity. ಸಾನಸ್ತನ ಆನಮ್ ಅಂಕ ಕಳ್ನ. But as the child grows, everything is fine. ಚೆರಡಾಗ ತೋಂಡ್ ಓಪನ್ ಕರು ಜತ್ತನ ಎದ್ರ ಎತ್ತಸ ಗ್ರೋ ಜಾಯ್ನ. So these are signs which the parents should catch. And before anything else, they should be cognizant about small falls from a height. तज विषय काळजी घेऊ का त्यांनी.
ओके आतां ह्या एक अर्ली सायन्स कळ्ळें आमकां आतां अनट्रिटेड केसीस आतां ट्रिटमेंट जायना ताका म्हण जाल्यार कसं जालें ताजे एडवर्सिटीज मुखार
Untreated cases, suppose the child is already ankylosis or fusion of the jaw bones to the skull base is set in. The consequences, the child will have difficulty in opening the mouth. Chabbuka, jaman bitar vachana. एक फिंगर सोडी 3 फिंगर सोडी 1 फिंगर भितर वचना. सो जेवणांतल्यार मालन्यूट्रिशन मागीर स्पीच रेस्ट्रिक्ट जाता. सो उल्लोवचें जायना जेवण करूं जायना स्पीच रेस्ट्रिक्शन डिसआर्टिक्युलेशन ऑफ स्पीच. वर्स्ट केस सिनारियो कसो जाता बिकॉज दिस इज नॉट ग्रोईंग द एअरवे इन द पोस्टिरियर एअरवे स्पेस म्हणटाच आमी म्हळ्यार आमगेल ओरोफॅरिंग्स म्हळ्यार श्वासकोश म्हणटा न्हय थंय दुखून आमगेल एअरवे आमी ब्रीथ करचें. सो इफ द लोअर जॉ इज प्लेस्ड बॅकवर्डली this airway space collapses. Okay. And when the child sleeps in the night, and this child will have awakening or arousal in the night, that is called obstruction.
Okay.
That is called obstructive sleep apnea.
Okay.
So these are patients who develop choking in the night and suddenly develop gasping for oxygen.
Okay.
All these are signs and symptoms of patients who are not treated. मला ट्रीटमेंट घ्या नातल्यारी these are the consequences.
Okay. आणि ह्या एक ट्रीटमेंटाक सर्जरी मात्र ऑप्शन की विदाउट सर्जरी वे कसले एक ऑप्शन जास्त ट्रीट करच्याक
ना for this particular case, if it's a proven case of ankylosis, surgery is only the choice of treatment.
ओके
आणि आमगेल OPD तू यथा प्रकार there are patients who come on a daily basis. I see a lot of patients coming with TMJ pain. Now I am 51 years old. My joints have served me for 51 years in eating, chewing, उल्लयतन. आम्ही कितले तोंड बंद दवरताची. सगळो दिवस आम्ही उल्लयताची, खाताची. So there is, या joint भितरी, there is something called as a meniscus or a disc.
ओके
Each time I open my mouth, the joint is coming forwards. ತಜ್ಬಿಟ್ಟು ತಜ್ ಮತ್ತಾರಿ ಡಿಸ್ಕ್ ಮೊಣಸ್ ಕೆಲವು ಸತಿ ಕಸ ಆತ ಏನ್ ಡಿಸ್ಕ್ ರಪ್ಚರ್ ಜಾವನು ಇಟ್ ಅಂಡರ್ಗೋಸ್ ಏಟ್ರೋಫಿ ಮಳರಿ ಡಿಸ್ಕ್ ಸ್ಟಾರ್ಟ್ಸ್ ಟು ಟೇರ್ ಅವೇ ಮಳ ಪಿಂತವತ್ತ ಪೈ ಅಂತೂ ಮೆನಿಸ್ಕಲ್ ಟೇರ್ ಮಣ್ತಾಚಿ ಆರ್ಥೋಪೆಡಿಷನ್ಸ್ ಟ್ರೈ ಟು ಅಂಡ್ ಸೇ ಮೆನಿಸ್ಕಸ್ ಟೇರ್ ಆಗಿದೆ ಮಣ್ಣು ತಶೀಂಚಿ ಹಂಗಾಯಿ ಡಿಸ್ಕ್ ಟೇರ್ ಜತ್ತ MRI ಅಂತೂ ತಾಮಿ ಫೈಂಡ್ ಔಟ್ ಕರ್ತಾಚಿ.
ಓಕೆ
These are patients who come to us on a regular basis saying, "Thond open kartana clicking sound asta, tuck tuck manta." These are earlier signs to understand that something is happening inside the joint. So this also can be a factor for a latent ankylosis.
Okay.
A rare cause, but it can cause. 96% of population across India has TMJ pain, which is very severe. ಕೆಲವು ಜನ ಸಂಗ್ತಾಚಿ ಕೆಲವು ಜನ ಗೊತ್ತು ಅಸನ.
ಓಕೆ
ಸೊ ದಿಸ್ ಇಸ್ ವಾಟ್ ವಿ ಫೇಸ್ ಆನ್ ಅ ರೆಗ್ಯುಲರ್ ಬೇಸಿಸ್.
आता एक सर्जिकल प्रोसिजर स्टार्ट करता री आता सर्जिकल प्रोसिजर जावन रिकवरी ताय कितला टाइम जाऊ का एक पेशंटान नॉर्मल्स येवच्याक.
Suppose if it's a child whom we had operated who is hardly 5 years old, ತಾನಂ ಪಾಪ ದುರ್ಬಲ ತಂಕ ಕಸನ್ ಮುಣು ಗೊತ್ತ ತಾನು ಸ್ಕೂಲ್ ಅವತ್ತನ್ ತಗೆಲೆ ತಕ್ಕೆ he would be mocked by his own peers.
Okay.
So neither did the parents know. They came to us financially very backward, Papa. So what we did was, it was like saying that we would do the surgery, but I was in a fix. Kasan surgery kuriyat. 5-year-old, 15 or 20 kgs,
Okay.
malnutrition, malnourished. So it was a team effort. We got a pediatrician to see, to advise what is the nutrition which needs to be given. And then we planned for the surgery. The first stage was, it's a staged procedure. Every patient who comes to us cannot be treated in a single stage. Kasala staged malari, many centers across India do it in a single stage. Malari, thond open jayna, kasala jayna, ya bone ang fix jala, jayt, ya cut koriya man. Cut kelli kudla thond open jata, jalata cheradal thond mukariyana. कायळशी असतो तो पाप लाईफ बरी. सो वॉट वी डिड वॉज वी वॉन्टेड टू इम्प्रूव द फेशियल डिफॉर्मिटी. सो चाजी खातीर आमी यंत्र घालनो वॉट वी कॉल एज डिस्ट्रॅक्टर्स. डिस्ट्रॅक्टर म्हळ्यार कसं न्हय, इट्स अ स्मॉल मॅशीन वीच वी प्लेस फ्रॉम आउटसायड अँड गिव टर्न्स एवरी डे. सो त्या टर्न दिल्ली कुठलं कसं जाता 6 months इट कीप्स ग्रोईंग फॉरवर्ड्स द जॉ. सो त्या 6 महिन्यान तूं चेरडाल वटू चॅलेंजीस कसं न्हय त्या चेरडू त्या यंत्र घेऊन खंय पडली म्हळ्यार आमगेली सर्जरी इज अ वेस्ट.
Okay.
I had to keep him in the hospital. Of course, my hospital supported this patient who was financially backward. So, 3 months he was with us in the hospital. We took care of him like growing a small plant. It's because we want to give the child and make a difference in his life. So, we looked after him. After that, yantra kanjal magiri, bone cut kele, tajanek so. So altogether, the entire process took us 1.5 years.
Bring back normalcy.
To come back, for the child to come back to normalcy.
ओके. सो ती सर्जरी पुढे प्री ऑपरेटिव्ह वर्कअप्स कसं असता आणि हातू मॅक्सिलोफेशियल सर्जन मात्र असतं की वॉट आर दी अदर डॉक्टर्स इन्वॉल्वड.
Okay. Before the surgery is planned, when the child is first seen by me or any maxillofacial surgeon who's operating on these kind of patients, and the first thing what we do is we get a thorough assessment done from the pediatrician or a pediatric department adukunu. Why do we need to get this done? To understand whether his blood counts are normal. And if these children have been treated multiple number of times in various centers across India, which I get, these are children who are prone for infections because they would have visited multiple hospitals. So MRSA, Monasta, methicillin resistant staph aureus, it's a colony of infection which is there in the hospitals, which the patients acquire because of multiple visits in multiple centers. So takka nasal swab kartachi, amgel COVID tester pudi kartashinchi. We find out if the child is MRSA positive. If not, then the next step involves understanding the sleep pattern of the child. Sleep pattern kasalaka, I spoke about posterior airway space and difficulty in breathing. So I send the child, other than the pediatrician, I send the child to a pulmonologist.
Okay.
A pulmonologist is a person who deals with our lungs and all the allied areas. So what does the pulmonologist do? He does a sleep study. What does the sleep study do? Like machine galno, ratta rati to cherudu niddata. That sleep study measures the apnea hypopnea index. How many times this child had difficulty and stoppage of breathing. The machine measures it. So one is a pediatrician, one is a pulmonologist, and another person who plays a very important role is an anesthetist. Kasalaka, because the child cannot open his mouth. At tond open jainatila mi tube kashgalche. Pragne tapuslikke. Before unconscious koruka, we need the tube to go inside the mouth or inside the nose. So anesthetists should be competitive enough to do this. Luckily, our anesthetists use the fiber optic. Today's recent advances is use of fiber optic intubation. Food ammi shiktana asal keza illa tracheostomy munkarta shininchi. Ang water kadchashini. But today, because of the advances, we have fiber optic intubation plus good competent anesthetists who can do this. So these are 3 or 4 people and a pediatric ICU specialist. Because after surgery, you need monitoring now. So these are 4 or 5 people who should be part of your team along with the cardiothoracic surgeon. So these form the core areas of our practice.
Okay. So मी या पुरे प्रोसिजर्स ऐकताना या एक लाईफ ट्रान्सफॉर्मिंग सर्जरी म्हणून येते. एक लाईफ ट्रान्सफॉर्मिंग सर्जरीचे एक डेफिनेशन सांगची म्हणजे जाल्यार
To say a life transforming surgery, in very simple words, if I have to tell you, not from the doctor's perspective, from the patient's perspective, it is improving the quality of life for the child. Putting back a smile on the child's face. For him to able to eat one scoop of an ice cream in 7 years of his life, or in an adult patient whom I had operated. I'll tell you one instance in Manipal when I served under the aegis of Manipal University. I had an adult patient who was a waiter in the hotel. He hadn't opened his mouth for 23 years.
Okay.
Pap taka jevana khana kasa mongotna. Tane jevchi kashi spoonana paj galnu tonda bitar sodche. He lived with that for 23 years. Okay. And when I joined Manipal, it was at that instance when I had just specialized and come back. And I operated on him and we did the joint replacement. One of the first primary cases in India. Today he enjoys every food like you and me. He does not have a deformity. His ankylosis was a milder type.
Okay.
So for me, life transforming is seeing patients eat, speak, leading a quality life without any kind of obstructive sleep apnea, able to talk, and moreover, having good dietary scores. That's quality of life.
सो ह्या एक सर्जरी करताना चॅलेंजेस कसं फेस करता तुम्ही एक सर्जरी जाता असताना और वेन यू आर डुईंग दिस प्रोसिजर?
When we treat these kind of patients, it's always a challenge. Right from the time the patient comes to our OPD, outpatient department, because we cannot think about only surgery as a practice. You have to take a holistic approach. Get all the specialists under one roof. More than anything, getting the financials organized for these particular patients. Because these are patients who come from a lower socio-economic strata. Let us agree to that. Because a person who is affordable, a lower middle class or a middle class, kasane trauma jalari, kasane pet jalari, they are not automatically go to a hospital and get checked. जाल्यार हे पाप दुर्बळ आसतना तांणी कसं पडल्यार नाका पुता कांय जायना तोंड ओपन करूं नको म्हणून आमी सांगता तो वळटा युनियनांक जाता. सो फॉर अस द बिगेस्ट चॅलेंज इज facing from the financial aspects. Other than that, suppose I use a distractor in the first stage to grow the jaw. Patient compliance. Patient should be compliant to get the turns done every day. The parent should be agreeing to leave their job and come and stay with us for a period of 3 months. That is one more challenging thing. And the other challenges are during the surgery. Because of very less of birth weight or the weight at that particular time, maintaining the anesthetic team has to take a lot of precautions, blood loss, which is normal with any other surgery. But special precautions are when the distractor or when the instrument is on the face. If the child is not able to maintain pai gaan jatar kai padlo, so vigilance is more important. So these are challenges what we face on a day-to-day basis when we handle these kids.
Okay.
Sometimes children don't know एकला लोटो एकल्यान खेळतना काही हात लागले म्हळ्यार मिगेल यंत्र तो गुपडलें and that time your treatment is half done.
Okay.
You cannot blame the child. Children are children. So these are challenges what we faced and we continue to face.
Okay. So ते एक पण सर्जरी जावन एक नॉर्मलसी आयलो एक पेशंट रिकरन्साचे चान्स असते की?
That's a lovely question. Recurrence chance depends on what kind of treatment you have given. Now, most of the times what I do is, these are cases where there is high chance of recurrence. If I take 10 patients today and look back, when I did my masters and then when I'm doing it now, I see recurrence out of 10 patients, at least 3 or 4 going into recurrence, which is not good news. Why is it? Because it depends upon the treatment what has been done. If you just cut off the gap there, if you just cut and make a gap and leave the patient, whether he's a pediatric or an adult patient, and he opens the mouth, the doctor is very happy. Oh, chaldan tond open jalla ani khaucha jatta mun. But believe me, physiotherapy, yeah, chaldan tond open karta aska.
Okay.
The day physiotherapy stops for the next 3 years post surgery, that's the time recurrence can happen. That means again bone can fuse to bone.
Okay.
So that's where today technology is come in such a great way. If you have the right indications, मला काही कसन कोरका म्हणून गोत असल्यारी जॉईंट रिप्लेसमेंट आता मी ऑर्थोपेडिक्स आयकताची हिप आणि नी रिप्लेसमेंट म्हणून तशींची आमगेल तोंडा फेशियल रिजनांतू जॉईंट रिप्लेसमेंट म्हणून करताची. If you have a correct indication and then you put in a joint there, chances of recurrence comes down by at least 97%. That's where we promote joint replacement. But that also comes with its own complications. That's why I'm stressing that proper indications, asla matra joint replacement koriyata.
Okay.
But there is a chance of recurrence.
Okay, what are those complications that?
Recurrence, as I said, one is bone formation, but when you place in joint in this particular area, we again borrowed that knowledge from our orthopedic colleagues.
Okay.
When you do a hip and knee replacement, the most common complication you find is a periprosthetic joint infection. Malari, joint gallel jagar dukun infection.
Okay.
It might be because of an internal source or an external source.
Okay.
Tashinch angami joint galtana infections can come from within or from outside to inside. So these are challenges. That's why I say joint replacement how shikku naila, that doesn't mean I use joints in every second patient, because that's the final line of defense. Tajinantar ya bulokar kasane na. So what we have to do is select our cases appropriately, select our patients based on their age, nutritional status and their compliance. That's how we have to select our patients.
यात ट्रीटमेंट करचे एक प्रोसेस अंत म्हळ्यार एक प्रोसिजरली चेडवांक करच्याक आनी होड्डांक करच्याक प्रोसिजर
difference asan why the difference is if it's a small child who's still growing, you just can't cut and leave. You have to grow this and then cut. If you don't grow this and you keep cutting, कसं जाता हें मागशी वता. Whereas in adults who have got ankylosis, where they have finished their growth period, like 21-year patient आयल म्हाका, I don't have to really worry. I can directly cut off and place a joint and come out. Whereas in children, joints are not advisable because it's a foreign body now, tantu. So you have to be very careful. That's why distraction, malari, grow korche, the yantradavavarnu, that has a major role to play.
ओके सो आता ह्या एक मॅक्सिलोफेशियल सर्जरी आणि एक अँकायलोसिसा ಬಗ್ಗೆ मस्त पुरे विषय तुम्ही शेअर केलेलं सर एक अवेअरनेस क्रिएट जाला म्हणून लेखता एक लास्ट एक क्लोजिंग कॉमेंट्स कसले आमगे लायक ऑडियन्साक सांगची म्हण जाल्यार ह्या एक विशय
एकची सांगूक what I would love to say, संचेरडो जेव्हा होड्ड जेव्हा संचेरडो घरा असताना all you have to take care is that once if they have a fall in the house म्हळ्यार चेरडू खंय पडलींची होड्ड जेव्हा खंय पडलींची वेर आमगेल चिन्न वचून नेला धडान घेतले the first thing you need to do is visit your dentist or your surgeon. थोडे दुखेस म्हूण लेखता आमी जाल्यार थंय कसं क्रॅक जावन आसल्यार you can pick it up early and prevent complications like ankylosis.
अर्ली स्टेजार ते धरले म्हण जाल्यार
Exactly. You catch it in the early stage, your complications can be nullified.
येस सो मस्त इन्फॉर्मेशन तुम्ही शेअर केलं हाजे विशयारी आमगेल्या ऑडियन्साक मस्त एक इन्फॉर्मेटिव्ह जाल्लेलो एक व्हिडिओ दिवचे तसला प्रयत्न आम्ही केलेलो आसा इतले वेळ मस्त पुरो इन्फॉर्मेशन तुम्ही शेअर केल्या जाल तितल्या तुम्ही तुमकां मस्त इन्फॉर्मेशन मेळ्ळा म्हणून हांव लेखता इतले वेळ आमगेलो टशील का तरी तुमकां मस्त धन्यवाद सांगता
Thank you very much.
इतले वेळ आमगेलो टू डॉक्टर अभय कामत हांणी आशिल्लेंची हांणी ह्या एक मॅक्सिलोफेशियल सर्जरी आनी अँकायलोसिसा ಬಗ್ಗೆ एक अवेअरनेस क्रिएट करका म्हणून एक उद्देशान आज आमगेलो टू ह्या एक व्हिडिओ मस्त पुरो इन्फॉर्मेशन तुमगेलो टू शेअर केलेलो आसा तुमकां ह्या इन्फॉर्मेशन आयकून मस्त खुश जाला म्हूण लेखता आनी एक अवेअरनेस वय क्रिएट जाला म्हूण हांव लेखता जाल तितले ह्या व्हिडिओ तुमगेल्या फ्रेंड्स फॅमिली पुराय जनांकय शेअर करा आनी काही मस्त जनांकय हाजे ಬಗ್ಗೆ एक अवेअरनेस क्रिएट जावो म्हूण सांगून आमी यूथ ऑफ GSB टिमा तर्फे आश पावताचे इतले वेळ आयच्या ह्या एक व्हिडिओ पळयले का तरी मस्त धन्यवाद थँक्यू